Right, let's move on to our top story this morning. A shocking new report from the Royal College of Emergency Medicine says that more than 250 patients a week may have died needlessly in England last year due to very long waits in A&E for a hospital bed.
Well, NHS data for England shows more than 1.5 million patients waited 12 hours or more in major emergency departments last year.
And the Department for Health and Social Care spokesman has told us this morning we are determined to continue improving experiences for patients and making access to care faster, simpler and fairer. We're making progress in reducing A&E waiting times, including adding an extra 5,000 permanent staffed beds this winter to increase capacity and help patients be seen as quickly as possible.
Well, Lucy Johnston is the Health and Social Affairs editor at the Sunday Express, and she joins us now. Lucy, this is really a worrying trend, isn't it? Because basically, before you used to call an ambulance and an ambulance would come. Now you could wait up to 4 or 12 hours. And A&E was a place where you could wait. You'd expect at least 4 hours. Now people are dying, waiting, some of them waiting more than 12. What's going on?
Absolutely. It is shocking and it's totally unacceptable. And it has been going on for some time. In fact, we did a bit of work on this earlier in the year. And there are half a million people waited more than 24 hours last year.
Wow.
in A&E. So that is a huge length of time. And the Royal College of Emergency Medicine has done some calculations and has worked out that for every 72 people waiting around 8 to 12 hours in A&E, there is one extra or unnecessary death. And this isn't a place for sick people to get better. There's noise, people are screaming, the lights are on, they're treated or not treated in corridors. They're effectively being abandoned in those corridors, and the government really hasn't got a grip on the situation, despite its promises and despite the money it's thrown at it.
So, Lucy, how many excess deaths are we running at a week? Because the ONS recently changed the way they calculated the figure, didn't they, to some controversy. I mean, I think it was something about 45,000 last year, but then they fiddled the figures and it's gone down to, what, 12 or 15? Where are we at?
Well, the figures are all, it depends on who you ask and what data set you're looking at. There was a set of figures that showed there was 53,000 excess deaths last year, highest levels, I think, since the Second World War. But whatever way you cut it, whatever way you look at it, we have levels running at pandemic levels. If you look at the graphs, which I was looking at just this morning, you can see that the levels of excess deaths are right. They're not, you wouldn't really notice there was a pandemic. And these people are not older as they were during the pandemic. These are younger people. These are people who are in their middle ages and sometimes even younger still. We have had various reports. In 2022, the British Heart Foundation produced a report showing just in that year there had been almost 40,000 excess heart-related deaths. But yet, the government hasn't properly investigated the reasons why people are dying, younger people are dying in excess numbers. Chris Whitty, the Chief Medical Officer, did a report and blamed the fact that during the pandemic there was a decrease in prescription, uptake in statin prescriptions. But since then, there's been a subsequent report showing there wasn't this decrease in statin prescriptions. So that doesn't explain it, and ministers have to really tackle this head on and get a grip of what is going on, because people are dying in thousands.
But Lucy, I mean, and I agree, whichever way you cut it, the numbers are absurd, even if they have changed the way you calculate it to try and make it look a little bit better. But what about the bed blocking and the fact that ambulances are usually waiting in queues and things like that? Surely that is one of the major reasons why they can't unload the ambulances and why there's a situation where people are hanging out in the ambulances. You've got people waiting in corridors and hospitals. What are they doing to try and solve that? Because that's one of the biggest reasons why this is happening.
Well, they have put, I think, $1 billion towards the recovery plan to try and recover emergency services. But as these figures that you're bringing today show, this hasn't worked. The 5,000 extra beds is not enough. And actually, what we need to look at is a fundamental reform and a change. Throwing pots of money, the NHS is famous at throwing pots of money to try and fix problems, which actually are deeply entrenched problems. So we have bed blocking, and that's partly to do with social care. We don't have a place for people to get to leave in the community. 13,000 people are stuck in beds. We have not enough beds anyway, not enough staff. It's a huge problem. And also there's the weekend effect. Just over Easter, there will be excess mortality because the hospitals are running at reduced capacity and people aren't being discharged. So we have to think about modernising the NHS, bringing it in line with Google, Tesco's, and making it a proper 24-hour service. That would do something, and improving social care. These are just two things.
Lucy, we're running out of time, unfortunately. We're just about done. But in 15 seconds, why aren't we receiving the same coverage of deaths, excess deaths, as we were during the pandemic? Do you remember every news station, every newspaper had a death count on the number of COVID deaths? We're running at similar or even higher numbers. Where's the same reaction?
Well, I absolutely agree. There should be press briefings, there should be investigations, and it's all to do with what we're choosing to focus, or what the government is choosing to focus on. But this should be a focus, and I agree, it's outrageous.
Okay.
Lucy, thank you so much. Well, listen, in response, an NHS spokesperson said that the latest published data shows our urgent and emergency care recovery plan, backed by extra funding with more beds capacity and greater use of measures like same-day emergency care, is delivering improvements alongside continued work with our colleagues in community and social care to discharge patients when they're medically fit to go home, freeing up beds for other patients.